my name is Zella Jewett, and my student ID number is 3433742, and these videos are for my second video set for my Clinical Pathology 1 course. So today we're going to be doing a buccal mucosa bleeding time, and the purpose of this test is to determine abnormalities in platelet function. So you want to make sure that you do this on a pet that has been sedated or anesthetized, and you want them laying in lateral recumbency with their lip tied up so that way you can access the mucosal surface, all of which I've already did. So you're going to get a spring-loaded lancet and a stopwatch, and at the same time that you deploy the lancet, you're going to start the stopwatch, and you're going to blot the blood away every 5 seconds. Okay, so you see a little blood droplet forming there. And I'm not actually touching the incision area. I'm just blotting it away until it comes back clean. Okay, it's almost there. Okay. So it came away clean. So it looks like the bleeding time for this dog is about 30 seconds. So the normal time for domestic animals is anywhere between 1 to 5 minutes. So this would be an abnormal result. And now we can go to the doctor, write down this result, and see what they would like to do next. So today we're going to be doing a blood chemistry test. So the purpose of a blood chemistry test is to measure various enzymes within the blood, and then that will give us an idea of how different organs are functioning. So to start out with, I have my rotor right here that I'm just going to go ahead and open. I'm going to make sure that I touch the sides of it and I don't touch the top or the little barcode area is. Then I have my blood right here. I'm just going to invert it gently a few times just to make sure that everything is well mixed and we get an accurate result. And then I'm going to take my pipette and put the tip on. And this pipette is designed so that way if I use it correctly, it will accurately dispense the right amount that I need into my rotor. I'm going to take the top off of my blood sample. And then I'm going to press down on the top of the pipette, insert it into my blood sample, and then gently release on the top. And I made sure that the tip of my pipette was in my blood sample the whole entire time that I was releasing, so that way I get all of the blood and not any air. So I'm going to take my rotor, and then there's a little hole with an arrow next to it. That's where I'm going to place the tip of my pipette. And I'm going to gently press down on the top of it. Put all of the blood sample in there, and then if for some reason I didn't use my pipette correctly, there's a couple of arrows on the side directly opposite the hole, and that's where you want your blood sample to go all the way to. So now I'm going to come over to my machine, and I'm going to select Analyze. That's going to open my drawer. Then I'm going to place my rotor inside and select Close. And then I have my patient information here. I want to select the species, so this came from a dog, and then I'm going to enter the patient ID number in it, and then select Done, and then we will come back and get our results after the machine is done with its analysis. Now that our machine is done with its analysis, I went ahead and printed off the results. So I have the results right here. These are all the values that the machine got for the specific sample, and these are all the reference ranges for it. It looks like the only one that is outside of the reference range is the glucose, and that could be because the pet has a condition such as diabetes, or it could be that it was stressed or improperly fasted before the blood draw. So now we can give these results to the doctor and see where they would like to go from there. So with this video, we're going to be doing a serological test, and the specific test we're going to be performing is an FELV-FIV rapid immunomigration test. So this specific test tests for the feline leukemia virus antigens and the feline immunodeficiency virus antibodies. And if there were to be any of the antigens or antibodies in your sample, basically what's going to happen is they will form complexes with the corresponding colloidal gold particles in the test kit, and as they move up the test strip, they will become captured and accumulate in the readable test area, and that's what's going to give you your positive result. So to do this, we have our test kit right here. This is the VetScan test kit, and this one you can use whole blood, plasma, or serum. I happen to have serum, so we're just going to open up the test kit, and we're going to get our serum sample. We're going to use a pipette to withdraw some of the serum, and we're going to place 1 drop of the serum into our well, and then we're going to get this buffer solution. This is just to help with the migrational flow of the complexes, and we're going to put 2 droplets in there, and now we just wait for 10 minutes and we will come and read our results. Okay, so now it's been 10 minutes, so now we can check to see what our test is. So with the test, you want to make sure that there is going to be 1 line right here. That's going to be your control line, and then that'll tell you whether or not the test is valid. And if there's any other lines, like the control line with the L or the I, that means that it would be positive for the feline leukemia virus if it's on the L, or the immunodeficiency virus if it's on the I, which it looks like there are no lines on here, so this would be considered a negative test result. So today we're going to be doing a heartworm direct smear analysis, and the purpose of this test is to look for any microfilaria within the blood to see if a patient is positive for heartworms or not. So you're going to want to use whole blood for this, and you want to make sure it's anticoagulated. So I have some here in an EDTA tube. So I'm going to take the top off of that, and then I'm going to use a pipette to withdraw some of my sample. And I'm going to place 1 small drop on my microscope slide. And then I'm going to take a cover slip and I'm going to place it on top of my droplet. And then this will help the drop just spread out and be more even. Then I'm going to place it underneath my microscope. And I'm going to focus it in on the 10 times magnification. Okay, so now that it's focused in, I'm going to do what we call clearing a slide, and what that means is I'm going to pick a corner. So since I'm in the upper corner, I'm going to go down all the way, move over a little bit, then go up all the way, move over a little bit, and then back down, and I'm going to keep doing that pattern until I've looked at the whole entire sample under the microscope. And what I'm looking for is any movement within the sample that would be evidence of the microfilaria moving around the blood cells. Okay, so I looked through the whole entire slide and I could not find any movement in there, so we would call this a negative for any heartworm microfilaria.